Okay, in this video we are going to cover the skeletal structures of the lower extremity. Okay, so let's get started. Today what we are going to do is cover the skeletal structures of the lower extremity, so that's part of the appendicular skeletal system. And let's first look at the pelvic girdle. In this case, the pelvic girdle attaches the lower limb to the axial skeletal system. The pelvic girdle is going to be made up of three bones. We're going to have the ilium on this bone. This is the primary one. So if you were to put your hands on your hips and you feel that bone around this area, that's going to be part of the ilium. Okay, so let's point out the three different bones, then I'll highlight a couple of the different structures that I want you to be aware of. This is not all inclusive. Definitely refer to your textbook or your lab manuals to find all the various structures that you are going to be required to know. So this is the ilium, and as I said, the pelvic girdle is made up of three bones. This is your first one. Second one is the ischium. Third one is going to be the pubis bone. Okay, so the ilium, a couple structures that I want you to know here is this ridge along the top. Okay, so let me go off of this. The ridge on the top here, that's known as the iliac crest. Okay, so that's the iliac crest. The ilium articulates with the sacrum at the joint, SI joint. So let me just draw a line here real quick so you can see the joint that I'm referring to. The SI joint, let's do this. The SI joint is going to be this joint here, okay? And you have one on each side, and that's where the sacrum articulates with the ilium. And let's look at it posteriorly. That joint is going to be this area, and that's the SI joint as well. Okay, so that's the anterior and posterior views of the SI joint. So we have the iliac crest. We're going to have your sacroiliac joint, or the SI joint in this case. The ischium, what we're looking at on this bone, the ischium is the bone that you basically are sitting on. So if you were to put your hand under your backside and you can feel that bone there, you are actually, let me raise this up, you're actually touching this part of the bone. So if you're putting your hand under your bottom and you would feel that bone, so your hand would be touching this part. So this is the ischium on this one, and specifically the ischiotuberosity is going to be just this region kind of right here. That's the part that you're sitting on. The pubic bone, or the pubis, you're going to have one on each side as well, and they join in the center at the pubic symphysis, which is this joint in this area. Okay, so this is the pelvic girdle on what we're looking at. A couple other structures. You're going to see this great big depression here. That is what's called the acetabulum. The acetabulum is what articulates with the femur. So this is where your lower limb comes in and adjoins this area. Now your ilium, your ischium, and your pubis. So let me go through here and let's look inside this acetabulum. So your ilium comes down, forms part of the acetabulum. The ischium forms part of the acetabulum, and the pubic bone forms part of the acetabulum. And then they all fuse in this area. So those three bones form the acetabulum. Okay. And we're going to see the articular surface. You can see this kind of a gray area here. This is, well, this is the articular cartilage, but this is called the lunate surface of the acetabulum. So this is what is articulating with what we'll talk about here shortly, and when we look at the femur, is the head of the femur. Okay, so that's the acetabulum. Again, you're going to have one on each side. And then we've got this hole here, that big hole, that's called the obturator foramen. Okay, that's the obturator foramen. And in living tissue, as in non-dead, there's going to be a connective tissue membrane that covers this area as well. Okay, so that is the pelvic girdle. We didn't cover a lot of these other structures. There's a bone. This portion of the bone here is going to have a name. There's going to be this part. This curve's got a part. So again, go through your lab manual, go through the textbook to figure out what structures you are going to be responsible for, and then look that information up. So now let's look at the lower limb, and let's start with the femur. So let's go here. Let me bring up the femur here real quick. Pelvis. Let me look at this. These different videos here or slides, this will show you the various parts of the ilium or the ischium or the pubis. Okay, so this is where you can find that information. And let's look at the lower limb. And the lower limb is going to be dealing with the thigh and leg. The thigh is going to be this upper portion, ankle and foot, and the leg. And then we have the ankle and foot down at the very bottom. Okay, so that's going to be the ankle and foot, and we're going to go through the various structures associated with that. So let's look at the femur specifically. Okay, the different structures that we can see on this screen is we have the head of the femur, and just as with the humerus in your arm, the articulating portion, and in the humerus is also called the head, this is going to be the medial side. So the first thing that you want to do when you look at these, at the bones, is to orient yourself to the position of the bone. Again, start with the anatomical position, put it in your mind, and we know that this is going to be facing medially. So this is the medial side, this is going to be the lateral side. Now we need to figure out what's anterior and posterior. If you rotate this around and you look at the distal end of this, okay, so the distal surface, you can, let me angle it here, you can see this great big groove down in this area. That's going to be on the posterior surface. If you rotate it around, you can see it's really not there. The patella is going to be over the distal end anteriorly, okay. This will help orient you as to position or to figure out is this right side or left side of the body. So now we have medial, lateral determined, we have anterior and posterior, and then it's just an easy piecing it together to figure out if it's right or left side. Okay, so this is the head of the femur, and it articulates with the acetabulum of the pelvis. The next one down is going to be the neck of the femur, and this just connects the head to the body of the femur. So this is the neck portion of this one. Let's look at the greater trochanter. So just as in with the humerus, we had greater and lesser tubercle. Here in the femur, we have the greater or lesser trochanter. And the trochanter on this one, this is the large portion that comes out. Let me rotate it around. You can see it from this way. This is the posterior view. And then we have the anterior view. And the greater trochanter articulate, or it's the attachment site for the gluteus medius muscle. Okay. The lesser trochanter, you can imagine it's going to be a little bit smaller than this, and that's this blue piece here. So looking at it anteriorly, the large lateral side is going to be the greater trochanter, and then we got this smaller little bump on the side, more posteriorly. That's going to be the lesser trochanter, and that's going to be the attachment site for the psoas major muscle. The lateral condyles, if you go to the distal end of this, okay, now we know this is the medial side. So if you come back up, the lateral condyle is going to be here versus the lateral condyle. Let me redo this again. Okay, lateral condyle versus the medial condyle. Okay. Don't get that mistake, or don't mistake that with the epicondyle or epicondyle. The lateral epicondyle is just right at the very tip of this, whereas this portion is the lateral condyle, and the condyle has the articulating surface. Okay, so this is what's going to articulate. In this case, is going to be with the meniscus. That's what it's going to come in direct contact with. The medial condyle, again, is going to be on this one, and if you guess right, that little spot here, that's going to be the medial epicondyle. Okay. You're going to see a sharp line right here coming down. That's called the linea aspera. And then we also have the gluteal tuberosity, and that's where some of the gluteus muscles attach to. Okay, so that's going to be the femur. Now let's go to, we didn't do the patella, so let me look at the patella real quick. Okay, the patella is going to be this structure here. That's a sesamoid bone. Okay, the patella is a sesamoid bone, and it's within the patellar tendon. So you're going to have your quadricep muscles, that's your anterior thigh, coming down here, and this is going to be the patellar tendon, that portion. Patellar ligament, and then it's going to insert into this bone, which is going to be the tibia. So that's the patella. Let's look at the tibia next. Okay. So this is the tibia. Again, anterior versus posterior. Anterior, you're going to see a little bump coming out this way, whereas posterior, it's indented a little. Okay. Also, you've got this little pointy thing down here. This pointy thing, that's going to be on the medial side. Okay. So anterior, and then this is medial. That will help to orient you if it's right or left side. A couple things that we have here. We're going to be looking at your medial condyle. Just as with the femur, we had a medial condyle. On the tibia, we also have a medial condyle. And then this actually comes into contact with the medial meniscus. Okay. And then your lateral condyle, obviously that's going to be the lateral side. We have your tibial tuberosity. This is what attaches, or the patellar ligament attaches to, is going to be the patellar tendon attaches to the tibial tuberosity. The anterior border or anterior crest is going to be that sharp line that you see going down the anterior middle portion. And then this is going to be the attachment site for the deep fascia of the leg. And that little pointy thing that I was referring to distally, that's your medial malleolus, also known as your ankle. So if you were to look at your ankle and that bump on your medial side, that's this bump that you're looking at. Okay, so that's the medial malleolus. Okay, so that's the tibia. The tibia is also the weight-bearing bone. The next bone, the fibula, is non-weight-bearing. Okay, so this is the fibula. I'll tell you what, let me go back to show you really quick those structures. Let me rotate it around. Okay, so we just looked at the tibia. Now we're going to be looking at the fibula, which is this bone. Okay, so let's go to the fibula. Let's look at the key things that we want here. The head that we're going to be looking at, just like the radius, we have a radial head. Here we have a fibular head. So that's that blue area up on top. And then we have your lateral malleolus. So if we have a medial malleolus, that bump on your medial side of your ankle, here's the bump on your lateral side, and that's this one here. That's the lateral malleolus. And the lateral malleolus attaches the anterior talofibular ligament and the calcaneofibular ligament. Okay. Going from here, let's look at your ankle, and let's look at your specific bones of the ankle. In your wrist, they are known as carpal, C-A-R-P-A-L. Here they're tarsal with a T, okay? So there are going to be 1, 2, 3, 4, 5, 6, 7 bones. Am I correct? 7? 1, 2, 3, 4, 5, 6, 7. Yeah, 7. Okay, so there's the calcaneus. This is going to be the largest bone in the foot. This is also the heel. So when you're walking and your heel hits the floor, you're hitting back down in this region right here. This is going to articulate with the talus. This bone here is the talus, which we'll cover next, as well as this bone here, which is going to be the cuboid. So the calcaneus forms the heel. It's the largest bone, articulates with the talus and cuboid, and it also allows or is the attachment site for the Achilles tendon. Achilles tendon comes down here. Let me move out. So this is your calf muscle, forms the Achilles tendon, comes down and inserts down in this area. Okay. The talus is going to be the second largest bone. It articulates with the tibia, which is this one, and fibula there. So superiorly, that's what it's articulating with, and it articulates with this bone, which is also the navicular bone. Cuneiforms, there's 3 actual cuneiforms. Okay, let me zoom out of this again. Okay, we're looking superior to inferior on this one. So this is your great toe, or the captain of the toes. So these are the cuneiforms. They are given, they're all known as cuneiforms, but one is known as the medial, one's the intermediate, one's the lateral. Okay, so if this is the medial side, your great toe is on the medial side. So this is the medial cuneiform. This is the intermediate cuneiform, and this is the lateral cuneiform. Okay, and the last bone, second to the last, we have the cuboid in this area. This is also going to articulate with the calcaneus here. Okay. It also articulates with all these other bones. I'm just identifying the primary ones. Okay. Let's go back. Also, the medial cuneiform is articulating with the great toe, metatarsal of the great toe. Intermediate is with the second one. And the lateral one is essentially going to be the third metatarsal in this case. And then the last bone that we did not mention is the navicular. Well, let me back that up a little bit. Okay, the navicular articulates part of the talus as well as the cuneiforms and a little bit of the cuboid. Okay, so that's the navicular bone. And the last legs, let's do the metatarsals and phalanges. So let me highlight those pictures here. Okay, so the metatarsals, as with the hand, we had metacarpals. Here we have metatarsals, and you have 5 of those. Okay, great toe all the way to the little toe, or the pinky toe. This one was also known to go to the market. Okay, so those are the metatarsals, and then we have the phalanges. So there's 5 metatarsals. Phalanges, we are actually going to have 14, just as we do with the hand. We have your proximal row of your phalanges. We have your middle phalanges. There's only 4 of those. Notice that the great toe, just as with the thumb, does not have a middle phalange. And then the distal phalanges are at the very tips. So those are your skeletal structures of the lower limb. If you are unfamiliar with some of these, go back, rewatch the video. And again, as with all these other videos, I'm expecting you to actually locate these on the models in the labs and identify them, because the quizzes will be on models, not on pictures. And trust me, there is no comparison when you're looking at the two. Okay. So that's it. We'll see you in the next video once I figure out what I want to talk about. Thanks.